COVID-19 was a classic example of how the most economically vulnerable in society bear disease harder than other segments of society. And this was illustrated in countries like South Africa and even in richer nations like the United States. The Global Council on Inequality says countries with less resources need solutions to be future fit for the inevitable eventuality of new pandemics, even as some continue to fight against the likes of HIV, Ebola and COVID-19, which wreaked havoc a few years ago. With the best among them in science, health and finance and other disciplines, they tried to work out why lesser resource nations have been struggling to contain certain diseases.
They've looked at all the evidence which is there and produced some of their own, and they are now showing us the strong links between inequalities within countries, inequalities between countries, and how they drive what could have been just an outbreak to become a pandemic, and then it is prolonged, and then it is more deadly, kills more people, disrupts economies, causes more inequality, and therefore the inequality then makes the countries less able to respond to the next one. So the cycle is there.
Fundamentally, the report found that inequality actually disables an effective pandemic response. And this speaks to inequality not just in relation to people's incomes, but their basic living and working environment. Co-chair of the Global Council on Inequality, Professor Joseph Stiglitz, talked about the need to have the right social determinants in order to build resilience.
What we mean by social determinants of health are all the other things, not just money itself, but all the other things that constitute society. For instance, your access to housing. Okay? If you live in slums, like in the picture in the cover, you're crowded together. No matter what your income is, your likelihood of coming down with a disease when it's contagious is going to be very high. And so that's a social determinant of health.
The Global Council is said to have spent 2 years pondering on the issue of pandemic readiness, particularly for poorer nations. And while it identified the fragilities, it also came up with a number of recommendations for global policymakers to consider, with government support for its citizens being a major underpin.
We find that social protection matters quite a bit. During COVID-19, when there was a push here in South Africa to expand the grants that were available, it mattered. The fact that you had countries around the world that did that, they reduced their COVID. When they didn't do that, they didn't. When it comes to HIV, giving young women access to capital gives them access to choices, which reduces HIV transmission. That's one concrete action. 2, we could be making the medicines of today right here in South Africa and in Brazil and in Thailand, and that would give us the capacity when the next pandemic hits to also be able to make those medicines. So you heard people talking about long-acting lenacapavir. That is a drug that's available today that we could be making in South Africa, but we're not because the global infrastructure has not allowed it, has not made that the priority.
Global Council members praised the South African government's pursuit of basic universal health care through the planned National Health Insurance Scheme, adding that access to health care would not be based on people's ability to afford it, but on their constitutional right. Health Minister Aaron Motsoaledi reiterated the government's position on NHI.
The situation is getting worse because of these gross inequalities. And yet when you try to correct, then they throw all sorts of missiles at you, etc., etc. Every sort of missile has been thrown at us for just mentioning the word NHI, universal health coverage. When then they realize the world is moving in that direction, the United Nations, the World Organization, is talking about universal health coverage. It has been adopted as one of the 17 Sustainable Development Goals.
The Global Council on Inequality is producing a number of reports ahead of the G20 Heads of States meeting taking place later this month, hoping that their findings and recommendations can go some way in helping nations build fairer societies in terms of access to opportunities across a spectrum of socio-economic issues, including health. Nampumela Losiziba, SABC News, Johannesburg.